When you deal with surgical dentistry and implant dentistry in particular, you need precision. The reason I chose the Immerse is because it's dependable, it's accurate, and it's versatile. It's an open system and it's very easy to use. For me, planning every case is very, very important. And there's a multitude of things I can do with the Immerse. In this case, we took a cone CT scan and used the AIS to do all the preliminary planning. And we also did an intraoral scan. And we planned the case in the AIS, and we merged these two images together and sent it to the technician. And then the technician used their own trusted software for planning the surgical guide. And after communicating with myself to show me how everything would look like, I was happy. Then they made the surgical guide and we received it back. And that's how we did the whole case. Once we plan the case, the software intelligently gathers all the information and it puts them in a report, which we can actually click one button and this report is generated in seconds. Among the excellent features of the AIS is the bone density, where with a click of a button, I can see visually or numerically what the density is like for that particular area. So after treatment planning, of course, you want to communicate with your patients. As we know, not everybody thinks the same. So before, we had cases where patients will decline purely because they couldn't understand or they couldn't visualize what we are trying to do. And now, with the help of the Acteon imaging suite, that's something of the past, because now they see the scan. A lot of time, patients will mention that actually this turned out exactly the way you said.
I knew that dental x-rays was possible, and I've had a dental x-ray done of my whole mouth before. I never realised that technology was so good that you could get a 3D image of inside my mouth.
So in this case, in combination with the images from the Immerse, we realized that the dimensions above the mandibular nerve were very limited. And as a result, I chose to use the cube for its accuracy and its control, allowing me not to damage the nerve while I'm preparing the site for the implant. And we achieved that very successfully. The way we do things today in my practice is completely different than we used to do many years ago. Because now we can combine the Immerse accurate images with a cube accurate performance. And that way we have a win-win situation for everyone, the patient and for us alike. Because of the nature of the cube being so easy to use, so fast, so powerful, and so efficient, we decided now to use it every case. I think it's time today for minimally invasive surgery, because we have the Immerse, we can plan the case perfectly, and then we have the cube that we can execute the case perfectly. So therefore, there's no need to make any case more complicated than they are. It helps me plan correctly, it helps me plan precisely, and more importantly, it helps me communicate with the patient, which is at the center of the treatment, but also with my community of colleagues through their reports and through exporting images or STL files or anything I want, because it's such a clever and open system. And because of that, I will never hesitate to recommend the Immerse.